When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome to Dr. Gore's show. Today, it's my pleasure to welcome Dr. Ziad Baker to Dr. Gore's show. Dr. Baker is a very, very busy pediatrician, well respected in northern New Jersey, and he did his training at Georgetown, then he went on to do training at Ross, and then he trained in New Jersey, and he has a multi-location pediatric practice in northern New Jersey, especially Bergen County. Welcome to Dr. Gore's show, Dr. Baker.
Thank you for having me, Dr. Gore.
So today we're going to talk about nutrition. You know, all the time when moms come and like they're always very nervous about, are they feeding the baby enough? Is breastfeeding better than formula? Why they have to feed baby at night? Can they give milk? So there are a million questions. So we'll start with, is breastfeeding better than formula, and what do you tell your patients?
Yeah, you know, the pediatric mantra when you become a pediatrician, they make you put your hand on the Bible and raise the other hand and say breast is best.
Right.
And that's Pediatrics 101. And there's no arguing with the advantages of breastfeeding. So most of the world doesn't have formula.
Correct.
Either the child's breastfed or they don't survive. And it's natural, there's a reason it's there, and you can't argue with nature. So breastfeeding has obvious advantages. It's natural, it's cheap, because you don't have to go and spend what amounts to thousands of dollars on formula the first year of life. The advantages are not only for the baby, but for the mom too.
Right.
Because she loses her weight quicker. She burns about 500 calories a day just breastfeeding. Also the bonding that takes place, the skin to skin.
Right.
Something that I always joke with my wife, I'll never experience that bond between the mom and the child that happens with skin to skin. And then the third, for the baby, the passive antibodies.
Right.
All the colds the mom got growing up, the chicken pox, the infections, she built up immunity, and now she's giving basically vaccines without any side effects through her breast milk to the newborn child.
Right.
So these are all the advantages of the breastfeeding.
Right.
So no good pediatrician is going to argue the advantages of breastfeeding. On the flip side, just because breastfeeding is great doesn't make formula bad.
Right.
So I always tell patients, with all the advantages of breastfeeding, when I have to put a patient sometimes in the hospital at 3, 5, 7 days of life back in the hospital, it's oftentimes because the mom is only willing to breastfeed.
Right.
Okay. Now, sometimes you have to supplement with formula, and frankly, sometimes you have to give only formula if the mom is on anti-seizure medicine or tuberculosis medicine. I get a lot of patients, they come from overseas, the mom's being treated for tuberculosis in countries where it's more common. You can't breastfeed the baby on those medicines. So then breastfeeding, when it starts to cause more harm than benefit, you give the formula.
Right.
And you know, the formula, you make sure the baby gets adequate calories, you don't run into dehydration, severe jaundice. So each case is different. Breastfeeding has multiple advantages, but you have to have a reasonable approach, and a good discussion with the OB and the pediatrician, and your personal medical history can guide you.
Right. And also, like, if you can't produce milk, then it's not bad to give formula, because as you said, you don't want the baby to get dehydrated.
That's
but
right.
The amount of immunity the baby gets, also, I think the studies have shown there's a reduced risk of asthma and everything as baby goes, compared to the babies which are breastfed and not breastfed, I think is so much out there. And what about water supplementation? Do you think they need any water along with the formula or breast milk?
You know, generally speaking, according to the American Academy of Pediatrics, there's no reason to give a newborn water until their first birthday.
Okay.
Okay, and when parents say, I can't believe that, I drink water all the time, half of your breast milk is water.
Correct.
Half of the formula is water. And half of the food we eat is actually water. So the baby won't get dehydrated.
Right.
Okay? They're still getting adequate volume in liquids. Further to the point, I always tell my moms when they say, but Dr. Baker, you know, she or he needs water. I say, listen, you know, what's the first thing you do after you have the baby? You want to lose all the baby weight. Okay? You drink more water. That's the first thing you do, because it interferes with weight gain.
Right.
The newborn has to double his birth weight at 4 months,
Right.
triple his birth weight at 12 months. That's incredible growth. You know, if I told you you're going to double your weight in 4 months, you'd think I was a quack, you'd find a new doctor, right? But that shows you how paramount nutrition is the first year of life. So water, as healthy as it is most of the time, actually directly impedes growth because it's 0 calories and it's taking the place of the milk that will enable the baby to thrive. So free water in and of itself should be given until 1 year. Now, if I have a baby, 6 months old, the mom's taking the baby, you know, to India where it's hot or to Miami for vacation, she says, Dr. Baker, you know, I'm going to give him 1 to 2 ounces of water here and there when it's hot outside. That's not the end of the world. But very early on, you want to give everything that enters the baby's mouth should have calories to help the baby thrive.
Right. So I think that's a very important point because usually the Indian mentality is like, oh, you have to give water, otherwise baby is going to get dehydrated, but you don't want to cut down on the calories. What are your thoughts about time feeding versus demand? Like that's always the question, oh, baby slept 3-4 hours now, let's wake up the baby and feed the baby. What are your thoughts?
You know, it's a great question because this question comes up with every baby. In the beginning, when I'm, you know, after you've delivered the baby and then I see the baby and I'm taking care of the baby, early on, I'm not a big fan of time feeding, okay? And the reason for that is, you know, mom doesn't know what she's doing. The baby doesn't know what he or she's doing. The last thing you need is to impose an artificial schedule, especially if you have breastfeeding. So, you know, the baby sucking on mom's breast actually stimulates, as you know, the hormone to produce more milk. So when the newborn sucks on mom's breast, it releases a hormone, prolactin, promote lactation. That's released in response to the suck reflex because nature, again, has trained the body, it's evolved the body such that now the body knows, I'm being a mom, I need to produce more milk. So in response to the frequency of the suck, your body will respond by producing more milk. In the beginning, you don't have that much milk. You have just drops called colostrum, which is a specific type of early breast milk, which is packed full of calories and nutrition because the baby's not getting that much. So nature made sure that the little bit the baby gets has extra vitamins, extra calories. As several days go by, your breasts become engorged and your milk comes in, then you could go longer with in between feeding. But again, you want to make sure whenever the baby's hungry, the baby gets to eat. Usually by 1 week of life, the baby shouldn't be eating more frequently than every 3 to 4 hours. Okay. And then by the 1 month mark, it's okay to start letting the baby sleep through the night. But in the beginning, they don't have stores or reserves. So if I skip a meal today, my body will break down fat and replace it. A newborn doesn't have those reserves. That's why they need to eat so much. And then after the 1 month mark, I always tell my parents, if you have the only baby in the world who'll sleep through the night, great, ride it out. But for the first month, you should expect every 3 to 4 hours. And in terms of quantity, when I send the baby from the hospital after 2-3 days, say, Dr. Baker, how do I know I'm giving the baby enough? I tell them, if you're not going to pump, you watch how much they urinate, how much they stool, you bring that into the office, and that'll tell me that you're doing well. If you're pumping or you're giving formula, very basic rule of thumb, there's 24 hours in the day. If you're doing 2 ounces every 2 to 3 hours, 3 ounces every 3 to 4 hours, you do the math, comes out to 24 ounces in the day. So 24 hours, you should be doing roughly 24 ounces early on until the 1 month mark.
Right. I think that's a very important point. Your baby, how it's doing, is kind of guiding you how much the mom is feeding and is it adequate or not. As the baby grows and becomes a little bit bigger, when do you introduce solid? Like how do you introduce, is there any tips for new moms, how to help them?
Yeah, absolutely. So very recently we've learned there's actually advantages to getting solids in early. So the American Academy of Pediatrics for decades said you shouldn't start solids till 6 months. And actually one of the main reasons we were afraid to start solids too early is the fear of allergies. We've learned actually if you could get in at 4 months of life, you will decrease food allergies. And well, why not push that number lower? Well, before 4 months, you actually contribute to obesity. So the sweet spot, as we say for pediatricians, is to give solids to the newborn at 4 to 6 months. So in my practice, I try to feed my babies at 4 months. I start with cereals, and I don't make a big deal out of cereals. Cereals used to be very popular in the old days, but again, when you look at cereals now, they're not the only foods fortified with iron. All the foods are fortified with everything. And actually, grains and cereals and starches are not the healthiest food for a baby. Cereals are good at the beginning for a couple of reasons. One, low incidence of allergies. You don't know many people who are allergic to grains. Secondly, soggy cereal, because that's the only food for the baby we put in the milk, is a good transition between a newborn who's only had a liquid diet and now you're going to give them solids. So soggy cereal is something that's not just milk, but not quite a brand new.
It's like a semi-solid.
It's a semi-solid. It's a good bridge to the vegetables. After 4 days on cereal, then there's an algorithm. You start with a vegetable.
Okay.
Let's say it's carrots. Monday, you do a little bit of carrot. Tuesday, more. Wednesday, more. Thursday, give a whole jar of carrots.
Okay.
No swelling of the lips, no blood in the stool, no eczema, no signs of allergies. 4 days of carrots, go to squash. Repeat the same algorithm. And after you've done 4 or 5 vegetables, each for 4 to 5 days, you go to fruit. And after that, then you can expand the menu to meats, yogurts, grains, lentils. And usually, after the 6-month mark, I tell my parents, if you're careful, you could introduce every food except honey and peanut.
Okay.
Honey and peanut are the only 2 foods not allowed until after the first birthday.
Okay.
Honey causes a rare disorder, but I've seen it, infantile botulism, where the baby, you know this, goes flaccid, can't breathe. We don't know why honey does this in infants, but not above the age of 1, but it does.
Right.
And it can be fatal, actually.
Right.
And peanuts, because they're the most common food to cause reaction, and they do so quickly. They cause anaphylaxis quickly, so you don't have time to react with the 6-month-old. When they're older, the system can handle it, drag the reaction out. It's not as dangerous.
Okay, so those are the 2 important points
Yes.
to do. What about foods like, say, Indian foods? When do they use them? Like a lot of times, yes, jars are good, they are practical to carry, but a lot of us want to feed the food that we eat. So say rice or say grains or lentils. Instead of giving them, say, packed, cereals, can they introduce homemade, non-spicy food?
Yeah, absolutely. So much of the Indian diet is some of the healthiest food any baby can have.
Right.
Actually, grains, lentils, these kinds of foods from the ground that are natural are very, very, very healthy. And before I forget, by the way, these grains, nuts, lentils are what I tell a lot of breastfeeding moms to eat to stimulate their milk production.
Okay.
Because they have properties that stimulate milk production. But for the newborn, after 4 to 6 months, once you've done the experiment and you've gradually increased the foods, after 6 months, if you want to carry lentils, grains, the rices, the Indian foods, as long as they don't have honey in them, and the peanut, but mainly the honey in my Indian patients, then I'm fine with them just giving the baby those food products.
Right.
As long as you've given it the first time in a controlled environment. I would just warn, if you have a 7-month-old, you say, well, Dr. Baker said we could give these foods. You never want to give 2 foods for the first time together.
Correct.
Because then you can't identify the reaction.
Right.
But you want to give a small taste of, roti or something new for the first time, that's fine with me. But do it in a controlled setting where you identify that it's the first time. But again, if it's not honey or peanut, there's a lot of advantages to expanding the menu very early on for the baby. As I said before, the evidence shows it decreases food allergies.
Correct.
So I'm all for it.
All right. And what about, the heartburns or acid reflux? I think in more and more cases, I hear from patients that the baby was diagnosed with reflux and had to take Pepcid. What's your advice? How to prevent it if we can, and what should parents look for?
Yeah, the acid reflux for many, many years was always thought to be an adult problem,
right?
Heartburn. And what we've learned in pediatrics is, when the adult patient comes to the office, they say, Dr. Baker, I have a metal taste in my mouth at night and I have chest pain. Even though the babies can't say that, it doesn't mean they're experiencing it less. And the best data shows 70% of babies experience some degree of reflux. About 5 to 10% need to be medicated for it.
Okay.
So the numbers are at least that of adults, if not more. The reasons are multiple. It's because of the way the baby's esophagus is very weak. And for those who are surprised by this information, I simply tell them the following. If I go to my doctor and I say, Dr. Patel, I have a problem. I spit up a little bit whenever I eat. And he says to me, Dr. Baker, that's fine. He doesn't know what he's talking about. But when you bring your baby to me and you say, Dr. Baker, my baby spits up a lot, we all accept that as normal. And that is a testament to the fact that we all understand the baby's GI system is a little immature, underdeveloped.
Right.
So reflux, actually, when you think about it, only makes sense that it's a problem much more in babies. Now, when do you draw the line? When do you medicate?
Right.
All babies spit up a little bit. But the signs I look for is when the mom calls me, she says, Dr. Baker, the baby doesn't like to eat anymore. She pulls her head away from the breast or the bottle. That tells me the baby's developed food aversion, which means he or she has learned when I eat, 20 minutes later it hurts, so I don't want to eat anymore. So they do the arching or pulling away. While spit up through the mouth is normal, the second sign I always ask for is the baby spitting up through the nose? That's never normal. So when they say, Dr. Baker, yes, he spits up, and by the way, 2 to 3 times a day comes through the nose, that's a harbinger or a red flag for pathologic reflux.
Okay.
So food aversion, not wanting to eat,
Right.
spitting up through the nose, Or if the baby's spitting up more than he or she's keeping down, these are signs of reflux, and I might consider a baby heartburn medicine like a Prevacid or a Zantac.
Right. I think those are very, very good points. So we're going to take a short break and we'll be right back to talk about another important topic, which is autism. We'll be right back.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome back to Dr. Gore Show. To talk about autism, you know, we've heard this word again and again, and it's become a major problem in the United States and worldwide. So tell me about autism. How do you define, and what's the incidence, and if we know, what are the causes or what we suspect them as causes?
Sure. So the first question you asked, Dr. Gore, is critically important because, you know, anytime we talk about any disease state in medicine, we say the definition. Right. And autism, the definition, is probably the trickiest of all diseases in medicine. And one of the reasons it's so controversial
right.
is because the definition in recent years has expanded dramatically. So our definition, you know, when we were in med school, they taught us pneumonia. It hasn't changed, the definition.
Right.
The definition for asthma really hasn't changed. The definition for autism has changed from year to year, and in fact, it's expanded.
The spectrum is changing.
Exactly. Now, by the letter of the law, so to speak, for those who are sitting there wondering, does this child or this family member have it, in terms of something you could sink your teeth into, it was actually a German physicist who, I think it was in the 60s or 70s, he had nothing to do with medicine, and he was doing an experiment, and he found this family, and the family had kids who kept on having these certain traits. And there's a triad of traits that led to this diagnosis and recognition initially, which was one, the children were basically mute. They didn't vocalize anything at an age where they should have. Let's say after the second birthday, they didn't talk.
Okay.
The second is that the children didn't demonstrate social intimacy. Well, what does that mean? Well, when the patient is 2 to 3 years old and he or she's your son or daughter, there's certain expectations of intimacy where he or she would kiss you and hug you and mommy
right.
and daddy. And these children, instead of doing that, would kind of treat mom, who they've been with for 2 years, like any stranger. So one is the lack of verbal communication. Two is the lack of social intimacy, eye contact, hugging, kissing, which you see children regularly do. And then the third, which is actually where the word autism comes from, he noticed these kids do automated behaviors.
Right.
So they come to the exam room and you see the child keep going, opening the door, closing it, coming back, opening the door, closing, coming back, or opening the drawer, closing, opening the drawer, where the mom at home will say, Dr. Baker, his brothers have all these toys, but he, for a year straight, only plays with the same train system right. over and over. So the triad is no verbal communication, no social intimacy, and automated behaviors or repetitive behaviors.
Correct.
However, we've kind of strayed from the orthodoxy of that definition recently and have come to see, while that's true in the most severe cases, like anything in medicine, there's a lot of mild and moderate cases.
Correct.
And that's why these days people are surprised when there's kids who have a diagnosis of autistic spectrum disorder who can talk, or autistic spectrum disorder, and they do hug and kiss their mom.
Right.
So the definition has now come to be just that, a spectrum of diseases with mild, moderate, severe. And so that definition captures many more people that maybe 20 years ago were considered slow
Correct.
or medically mentally retarded, but now fall in the category of autistic spectrum disorder.
Right.
So that's the definition, somewhat complicated, but that's kind of a good understanding. The second thing was the incidence. Again, in part due to the expansion of the definition, but also many other reasons, the incidence has climbed dramatically.
Right.
20 years ago, we thought autism was 1 in 1,000.
Okay.
10 years ago, it was 1 in 500. 5 years ago, autism was thought to be 1 in 110. Right now, in 2012, autism is thought to afflict 1 in 70 kids in northern New Jersey.
Wow.
Boys 1 in 70, girls 1 in 100.
Right.
Okay. Now, The incidence is climbing very fast. Of course, the debate is on what the cause is. And I'll be very frank, the best medical literature doesn't have a good answer right now. And this, of course, lends itself to speculation. And at the top of the list of speculation is, of course, vaccines. You know, you may ask me about vaccines, but just to answer the third part of your question in terms of therapies for autism, it's just that, it's therapies. There is no cure. There is treatment. For those who are watching that might not understand, different for physicians, we categorize things as no hope, treatment, or cure. Cure is when we can be heroes. We can tell you we're going to fix this and you can forget about it. Treatment is where we can take many measures to mitigate the symptoms, but not necessarily get rid of them altogether. And in autism, what we've learned is the timing of the diagnosis is critical. The earlier we make the diagnosis, the earlier we get in and intervene, and the better the prognosis. So there's behavioral modification therapy where specialists, developmental specialists, physical therapists, occupational therapists can help improve the child's prognosis, sometimes dramatically.
Right. So I think you've said it in such a nice way as far as the definition, because not only the cases are rising, but I think we are more aware and we are picking them up. And as you said, the people that we didn't diagnose earlier, we are diagnosing them as either a spectrum of autism. Now, you know, there are a lot of theories behind autism, because since we don't have the exact cause, everybody comes up. And as you mentioned, vaccination is one of the #1 that people like to blame. But apart from the fact that we know is that it does run in special families, it tends to be localized in some geographic areas, and mainly in men. So is there like a trend that we see here that we think might be linked to the etiology of autism?
Yeah, I think the first point you raised is the most important. Good data shows something very striking and very telling, which about 40% of monozygotic twins separated at birth, whether because of orphanages or whatever, when they've been followed, up to 40% of them will have autism or autistic spectrum disorder. What that means simply is the humans that have the closest genetic footprint, so to speak, that we have, when we trace them, have a very high incidence of autism. And what does that tell us? It tells us there's no denying the role of genetics in autism. And what you said, Dr. Gore, I see in private practice. And many pediatricians have autistic families where the parents had one child, he or she was autistic, and you know, the next child, same thing and same thing. And that's not going to be just coincidence. There's no question there's a genetic predisposition to that. And it tends to run in certain families, and that applies to the same point. Now, the counter to that, of course, as well, how come most kids with autism don't have siblings with autism? Doesn't that point against genetics? Well, there's also the flip side, which I think is there's oftentimes an environmental trigger. And that makes you, so you have to have the susceptibility and you have to have the trigger.
So it's a multifactorial.
Multifactorial is the exact word to describe it. It's multifactorial, which of course makes it very complicated. When people try to understand it, an example I give them is the recent literature on cholesterol. You know, we all want our cholesterol low. The most popular medicines are cholesterol-lowering medicine. And of course, we've come to learn now 2/3 of your cholesterol is genetic. So some people are just lucky. They could eat whatever they want, and no matter what, their cholesterol is going to be in the low 100s. And some of us, no matter what we do, it's going to be in the high 100s, and you just try to control the little bit you can. And genetics, you know, the more we learn in medicine, the more we realize it's all genetic.
And apart from that, the environmental factors, right? As you suggested, it's the stress of one individual at one location might make them more susceptible to this. And maybe there's some link to the vaccination, but as of now, what do you think about this vaccination controversy?
Yeah, the vaccine controversy, you know, the bottom line is as follows, and there's a lot of debate on it. You know, personally, I'm very pro-vaccine, and I'll start with what I always tell my patients in my practice, because they come to me and they say, Dr. Baker, I don't know about the MMR, I don't know about the chickenpox vaccine. Doesn't it cause autism? And I start by telling them, listen, I gave my son all his vaccines exactly when he should have gotten it.
Correct.
And the pediatricians I work with all do the same thing. And the reason I think that's important is because that's a testament to how we feel about the vaccines themselves.
Correct.
And any good doctor I know, and I know you're like this, you treat every patient like a family member.
Correct.
And so I start with that. In terms of the evidence, there's been 14 federally funded studies on vaccine linked to autism in the past 10 years. All 14 showed no link.
Correct.
In the UK, which is where this rumor started
Right.
by Dr. Wakefield, who now has been delicensed and is not allowed to practice medicine because he actually fabricated data for the study, they actually discontinued giving the MMR vaccine for a while. What happened was measles rates climbed and autism rates climbed. In pockets of the United States, they've done similar kind of experiments, and unfortunately, there was no impact on autism rates declining. They continue to climb even in parts of the country or the world where we don't give these vaccines.
Correct.
So I really don't think it's the vaccines, and I'll tell you something else. I even go further and I tell people, I wouldn't be surprised if in 5-10 years we find out that in fact there is an environmental trigger that causes autism. I honestly think there's an environment, but the one thing we've studied is vaccines. We haven't studied our cell phones. We haven't studied
Exactly.
the styrofoam cups we all drink coffee from.
Or microwaves and...
We haven't, yeah. It could be anything in our environment that we use, but the one thing we've looked at very carefully is in fact vaccines.
Right. And I think I say the similar things, I would say. And I say vaccine has been in use for decades. And if it was all due to vaccine, then we would have had thousands and thousands of cases,
Exactly.
if not millions, of people with vaccination who should have developed autism. So I completely agree. We still don't know what causes it, but most likely it's not the vaccine. But I think, as you mentioned, intervention is very important. And I think the hard part sometimes for parents that I see is acceptance. And especially with Indian culture, it gets like stigma that they don't want it attached. And it becomes a very sensitive topic sometimes to bring it up. But I tell patients that there's no stigma here. If the baby gets diagnosed early, gets intervention early, there can be a dramatic change. So I think that point I want to come across with all our viewers, that don't be shy. If your doctor thinks, let the baby get evaluated, and maybe there will be a better hope rather than denying it, and then it just becomes harder to, get this baby better.
Yeah, I couldn't agree with you more. I have many Indian families in my practice whose children suffer from autism, just like I do across all ethnic cultures. But I'll tell you, it's those families in any culture who come to me, who share their concerns, and who are willing to listen, that actually, even if you want to look at it from a stigma perspective, the truth of the matter is, the earlier you have the conversation you mentioned, the earlier we're able to intervene. And then if you fast forward 3, 4, 5 years, these are the kids with autism who are quote unquote mainstreamed.
Correct.
And all of a sudden now, after intensive therapy between the ages of, let's say, 2 or 3 and 5 or 6, they're in first grade with their peers, and if you went through their chart, and I have patients like this, I go through the chart, and I can't even believe that 3 years ago they were all labeled autistic, and in fact they were, because they suffered from all the classic symptoms. And now if you or I were to meet the child, we wouldn't believe it. And that's oftentimes a result of these such conversations. So I agree with you 100%, and I tell all my families in the same vein, the real pediatricians are the parents.
Correct.
Our job is to guide them, be there when they have questions. But if those questions don't arise, we can't even help with the answers.
Correct. Thank you for coming on, Dr. Ghosh.
Thank you for having me.
Good night, and till next time, stay healthy. You can view the show if you missed it or you want your friends or family to see it. You can always view it again on www.youtube.com and go on Dr. Ghosh Show, and you should be able to see this show again. Good night.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.